So yes, I'm at another one of my locations today. Another day, another dollar. Just want to give y'all some helpful tips and the seats to show you the consistency in the setup. Much smaller space, but still run different things out of this office as well, including a home health agency that only does attendant care. Um, as we walk towards the door, as you can see, I'm on here. Again, True Sanctuary, which is the PAS company, agency, hours of operations, my emergency call stuff. I also run a CPR training center with about 30 instructors up under me. And so I also do BLS, ACLS, PALS, NRP, all of the trainings, right? Walk in the office, pretty simple layout. As you can see, my little CPR training equipment up there. And again, I do all of the training, so you can get at me for that too. And you see that license on the wall? Personal Assistance Services, right? But you see that license clear displayed. Walk in here, I have, basically a setup again. Nothing fancy. You don't even have to have, again, all of this stuff, small refrigerators, etc. My little UMA phone line. Turn around this way, and we have basic office setup, right? Chairs if a client comes through or a caregiver comes to pick up their check, or whatever that may look like, or just for an interview. But a basic, nice little setup, right? All-in-one copy scanner, fax copier, just enough space to operate and put our documentation together. There is a shredder on the floor down there. And then, of course, those little file cabinets, man, to make sure they can lock. I want to talk quickly about this document right here, Policy and Procedures Manual. So, and I'll include a document that shows you exactly like what should be included in this. But I just advise you not to try to create this yourself. So, again, major sections should be leadership, management of human resources, rights and ethics, assessment, care, treatment, service, and continuum of care, environment, safety, and equipment management, management of information, quality assurance, performance improvement, and then surveillance, prevention, and control of infection. And when you go to mine, the table of contents is really thorough, right? It actually labels it based on that table of contents, LD, which is my leadership development. And so I know how to go straight to HR, or be all of the ones labeled HR, and I have these little tabs here, right? I have these set up in many different ways, but this is just a basic, good, solid policy and procedures manual for PAS. So now I will tell you this. Man, don't let people sell you a dream and make you fund their dream. Or even worse, sell you a nightmare while you're funding their dream. There are a lot of consultants out here that are not worth a wooden nickel in terms of the advice they give you. They're creating these policy and procedures manuals with ChatGPT, and they're almost never completely in compliance. You don't need a very thick policy and procedures manual, but you do need one that's thorough, consistent, and compliant. But I say if you find somebody selling you something that's like 60 pages, 15 pages, 70 pages, it's probably a very trashy policy and procedures manual. It's always just best to buy them from a reputable source, right? Many consultants sell them, but they also have agencies that have passed audits and inspections, so their stuff actually works because it's been shown and proven, like mine, right? When I consult a person, I actually duplicate my policy and procedures, whether it be for hospice, whether it be for skilled nursing or the skill side of the business in pediatrics, or whether it be for PAS. But I know that what I give you is going to work because they've already been through the fire. They've already been tested. But to be safe, and you're not in a position to hire a consultant, just make sure you get it from a reputable source. Like, pay the extra money, whether it's joint commission, whether it's ACHC, whether it's CHAP, right? It's a bunch of them out there. It's a bunch of places out there that will give you these policy and procedures manuals that's all they do or they specialize in. and you know that there are state compliance, especially the accrediting agencies, because they are the ones that are so thorough that if you pass their audit or inspection before the state gets to you, the state will actually allow that to be used as your visit, your state visit. So you know that you can't go wrong if you're buying it from them. All I'm saying is if it costs you $800 for policies and procedures or more, they're probably really solid and it's worth the investment. You can go at it alone. You can try to chat GPT it or whatever AI you're using, but I'm telling you that most of the time you're gonna hit a snag. Most of you are then gonna turn around when you're panicking because now it's almost time for a survey, and you're not sure if your stuff is compliant and meets the minimum standards. And that's the wrong time and the worst time to now get caught unprepared. So what I'm saying is, when it comes to policies and procedures, buy them from a reputable source. I personally, my company does provide those with the consultation or with the course or whatever you buy. So again, it's up to you. But all I'm saying is, just do it right. Invest in yourself. If you can't afford a good policies and procedures manual to run your home care agency, you really can afford to be in this business. And that's just the honest truth. So that's your tip for today. I'll actually include a outline of what you should be looking for when you're buying somebody's policies and procedures, just the minimum state guidelines, to make sure that you at least are compliant, and then you go from there. Have a great day. Healthcare Wealth Builders, let's get out and start creating legacies.